Welcome to Path to Nursing. Let's practice 30 NCLEX-style questions with detailed rationales. Let's begin. Question 1. A client with type 1 diabetes mellitus asks why insulin is required every day. Which response by the nurse is most accurate? A. Your body does not produce enough insulin. B. Your pancreas no longer produces insulin. C. Your liver cannot store glucose. D. Your kidneys remove too much insulin. Correct answer, B. Your pancreas no longer produces insulin. Rationale. Type 1 diabetes is caused by autoimmune destruction of the pancreatic beta cells, resulting in little or no insulin production. Lifelong insulin therapy is required. Question 2. Which assessment finding is most consistent with hyperglycemia? A. Diaphoresis. B. Tremors. C. Polyuria. D. Bradycardia. Correct answer, C. Polyuria. Rationale. Hyperglycemia causes osmotic diuresis, leading to polyuria, polydipsia, polyphagia, fatigue and blurred vision. Question 3. A client with diabetes becomes confused and diaphoretic. What should the nurse do first? A. Administer insulin. B. Check the client's blood glucose level. C. Encourage exercise. D. Restrict oral fluids. Correct answer, B. Check the client's blood glucose level. Rationale. Confusion and sweating suggest hypoglycemia. The nurse should verify the blood glucose level immediately before proceeding with treatment if possible. Question 4. Which laboratory value confirms the diagnosis of diabetes mellitus? A. Hemoglobin A1C of 6.5% or higher. B. Blood pressure of 140/90 mmHg. C. Potassium level of 4.0 milliequivalent/L. D. Hemoglobin of 14g/dL. Correct answer, A. Hemoglobin A1C of 6.5% or higher. Rationale. An A1C of 6.5% or higher on appropriate testing is one of the diagnostic criteria for diabetes mellitus. Question 5. A client reports drinking large amounts of water and urinating frequently. These symptoms are most likely caused by A. Hypoglycemia. B. Hyperglycemia. C. Hypertension. D. Hyperkalemia. Correct answer, B. Hyperglycemia. Rationale. Elevated blood glucose causes excess glucose to spill into the urine, leading to increased urination, polyuria, and excessive thirst, polydipsia. Question 6. Which client is at the highest risk for developing type 2 diabetes mellitus? A. A 25-year-old marathon runner. B. A 50-year-old client with obesity and a sedentary lifestyle. C. A teenager with asthma. D. A client recovering from appendectomy. Correct answer, B. A 50-year-old client with obesity and a sedentary lifestyle. Rationale. Risk factors for type 2 diabetes include obesity, physical inactivity, increasing age, and family history. Question 7. A nurse teaches a client about diabetic foot care. Which statement by the client indicates correct understanding? A. I'll walk barefoot at home. B. I'll inspect my feet every day. C. I'll soak my feet in hot water every night. D. I'll trim my toenails very short. Correct answer, B. I'll inspect my feet every day. Rationale. Daily foot inspection helps detect injuries early and prevents complications. Clients should avoid walking barefoot and avoid exposing their feet to very hot water. Question 8. Which complication is most commonly associated with poorly controlled diabetes? A. Cataracts. B. Diabetic neuropathy. C. Appendicitis. D. Pneumothorax. Correct answer, B. Diabetic neuropathy. Rationale. Persistent hyperglycemia can damage nerves, causing diabetic neuropathy, one of the most common long-term complications. Question 9. Which nursing intervention is most important for preventing diabetic complications? A. Encouraging the client to skip meals. B. Monitoring blood glucose regularly. C. Avoiding exercise completely. D. Limiting fluid intake. Correct answer, B. Monitoring blood glucose regularly. Rationale. Regular blood glucose monitoring helps maintain glycemic control and reduces the risk of both acute and chronic complications. Question 10, bonus SATA. A nurse is teaching a client newly diagnosed with diabetes mellitus. Which instructions should the nurse include? Select all that apply. A. Monitor blood glucose as instructed. B. Inspect your feet every day. C. Take medications exactly as prescribed. D. Walk barefoot inside your home. E. Eat a balanced diet and exercise regularly. Correct answers, A, B, C, E. Rationale. A. Blood glucose monitoring helps guide treatment decisions. B. Daily foot inspection helps prevent serious foot complications. C. Adhering to medications improves blood glucose control. D. Walking barefoot increases the risk of cuts, burns, and infections. E. Healthy eating and regular physical activity are key parts of diabetes management. Question 11. A client with diabetes asks why the nurse checks the hemoglobin A1C level every few months. What is the nurse's best response? A. It measures your blood glucose over the past 2 to 3 months. B. It measures today's blood glucose only. C. It checks kidney function. D. It measures insulin levels. Correct answer, A. It measures your blood glucose over the past 2 to 3 months. Rationale. Hemoglobin A1C reflects the average blood glucose level over approximately 2 to 3 months and is used to evaluate long-term diabetes control. Question 12. A client with diabetes reports blurred vision and excessive thirst. Which condition does the nurse suspect? A. Hypoglycemia. B. Hyperglycemia. C. Stroke. D. Hypertension. Correct answer, B. Hyperglycemia. Rationale. Blurred vision, polydipsia, polyuria, and fatigue are common symptoms of elevated blood glucose levels. Question 13. Which laboratory value requires immediate nursing intervention? A. Blood glucose 48 mg per deciliter. B. Blood glucose 110 mg per deciliter. C. Blood glucose 125 mg per deciliter. D. Blood glucose 140 mg per deciliter. Correct answer, A. Blood glucose 48 mg per deciliter. Rationale. A blood glucose level below 70 mg per deciliter indicates hypoglycemia. A level of 48 mg per deciliter is severe and requires immediate treatment. Question 14. A nurse is teaching a client with diabetes about foot care. Which statement by the client indicates a need for further teaching? A. I'll inspect my feet every day. B. I'll wear well-fitting shoes. C. I'll use a heating pad if my feet feel cold. D. I'll wash and dry my feet carefully. Correct answer, C. I'll use a heating pad if my feet feel cold. Rationale. Clients with diabetes may have decreased sensation and can easily burn their feet. Heating pads should be avoided. Question 15. A nurse is caring for a client experiencing hypoglycemia. Which symptom should the nurse expect? A. Dry skin. B. Fruity breath. C. Cool, clammy skin. D. Deep rapid respirations. Correct answer, C. Cool, clammy skin. Rationale. Hypoglycemia activates the sympathetic nervous system, causing sweating, cool clammy skin, tremors, and tachycardia. Question 16. Which nursing intervention helps reduce the risk of diabetic nephropathy? A. Maintain good blood glucose and blood pressure control. B. Drink sugary beverages daily. C. Avoid all exercise. D. Restrict all protein without a prescription. Correct answer, A. Maintain good blood glucose and blood pressure control. Rationale. Controlling blood glucose and blood pressure significantly reduces the risk of kidney damage in people with diabetes. Question 17. A client with diabetes complains of numbness and tingling in both feet. Which complication does the nurse suspect? A. Retinopathy. B. Peripheral neuropathy. C. Stroke. D. Heart failure. Correct answer, B. Peripheral neuropathy. Rationale. Peripheral neuropathy is a common long-term complication of diabetes caused by chronic nerve damage. Question 18. The nurse is teaching a client how to prevent hypoglycemia during exercise. Which instruction is appropriate? A. Exercise on an empty stomach. B. Check blood glucose before and after exercise. C. Skip diabetes medication before exercising. D. Avoid drinking water during exercise. Correct answer, B. Check blood glucose before and after exercise. Rationale. Exercise lowers blood glucose and may increase the risk of hypoglycemia. Monitoring helps prevent complications. Question 19. A client with diabetes is scheduled for surgery and has been instructed to remain NPO. What is the nurse's priority action? A. Hold all diabetes medications without consulting the provider. B. Check the client's blood glucose and follow prescribed orders. C. Encourage the client to eat breakfast. D. Cancel the surgery. Correct answer, B. Check the client's blood glucose and follow prescribed orders. Rationale. Clients who are NPO still require careful blood glucose monitoring and individualized medication management according to provider orders. Question 20, bonus SATA. A nurse is teaching a client about managing diabetes. Which instructions should the nurse include? Select all that apply. A. Monitor blood glucose regularly. B. Keep follow-up appointments with the healthcare provider. C. Inspect your feet every day. D. Walk barefoot at home. E. Eat a balanced diet and stay physically active. Correct answers, A, B, C, E. Rationale. A. Regular glucose monitoring helps guide treatment. B. Routine follow-up visits help detect and manage complications early. C. Daily foot inspection reduces the risk of ulcers and infections. D. Walking barefoot increases the risk of injury and infection. E. Healthy eating and regular exercise are essential components of diabetes management. Question 21. A client with diabetes has a fasting blood glucose of 250 mg per deciliter. Which symptom should the nurse expect? A. Sweating and tremors. B. Polyuria and excessive thirst. C. Cool, clammy skin. D. Bradycardia. Correct answer, B. Polyuria and excessive thirst. Rationale. Hyperglycemia causes osmotic diuresis, leading to increased urination, polyuria, and excessive thirst, polydipsia. Sweating and tremors are more consistent with hypoglycemia. Question 22. Which complication of diabetes is considered a microvascular complication? A. Stroke. B. Coronary artery disease. C. Diabetic retinopathy. D. Peripheral arterial disease. Correct answer, C. Diabetic retinopathy. Rationale. Microvascular complications include retinopathy, nephropathy, and neuropathy. Stroke, coronary artery disease, and peripheral arterial disease are macrovascular complications. Question 23. A nurse is caring for a client with diabetes whose blood glucose is 58 mg per deciliter. The client is awake and able to swallow. What is the nurse's priority action? A. Administer 4 insulin. B. Give 15 grams of a fast-acting carbohydrate. C. Restrict oral fluids. D. Encourage the client to sleep. Correct answer, B. Give 15 grams of a fast-acting carbohydrate. Rationale. According to the 15-to-15 rule, conscious clients with hypoglycemia should receive 15 to 20 grams of a fast-acting carbohydrate and have their blood glucose rechecked after 15 minutes. Question 24. Which assessment finding suggests diabetic ketoacidosis, DKA? A. Cool, clammy skin. B. Kussmaul respirations and fruity breath. C. Bradycardia. D. Constipation. Correct answer, B. Kussmaul respirations and fruity breath. Rationale. DKA is characterized by hyperglycemia, ketone production, metabolic acidosis, Kussmaul respirations, dehydration, and a fruity, acetone, breath odor. Question 25. Which nursing intervention is most important when caring for a client with DKA? A. Encourage sugary drinks. B. Administer insulin and 4 fluids as prescribed. C. Restrict fluid intake. D. Encourage strenuous exercise. Correct answer, B. Administer insulin and 4 fluids as prescribed. Rationale. The primary treatment goals for DKA are fluid replacement, insulin therapy, and correction of electrolyte imbalances. Question 26. A client with diabetes asks why they should have a yearly eye examination. What is the nurse's best response? A. To detect diabetic retinopathy early. B. To improve hearing. C. To diagnose hypertension. D. To prevent cataracts only. Correct answer, A. To detect diabetic retinopathy early. Rationale. Diabetes can damage the blood vessels in the retina. Regular eye exams help detect retinopathy before vision loss occurs. Question 27. Which snack is the best choice for treating mild hypoglycemia? A. Grilled chicken. B. Peanut butter sandwich. C. Half a cup 120 milliliters fruit juice. D. Cheese cubes. Correct answer, C. Half a cup 120 milliliters fruit juice. Rationale. Fruit juice is a fast-acting carbohydrate that quickly raises blood glucose. Foods high in protein or fat act more slowly and are not the best initial treatment. Question 28. A client with diabetes is being discharged. Which statement indicates the client understands proper foot care? A. I'll walk barefoot around the house. B. I'll inspect my feet every day. C. I'll soak my feet in hot water every night. D. I'll cut my toenails into the corners. Correct answer, B. I'll inspect my feet every day. Rationale. Daily foot inspection helps identify injuries early. Clients should avoid walking barefoot, soaking feet in hot water, and cutting toenails into the corners to reduce the risk of injury and infection. Question 29. Which finding suggests that a client's diabetes is well controlled? A. Hemoglobin A1C of 6.4%. B. Frequent episodes of hypoglycemia. C. Random blood glucose of 300 mg per deciliter. D. Persistent ketones in the urine. Correct answer, A. Hemoglobin A1C of 6.4%. Rationale. An A1C close to the target range, often around 7% or individualized by the provider, suggests good long-term glucose control. Frequent hypoglycemia or persistent hyperglycemia indicates poor control. Question 30, bonus SATA. A nurse is teaching a client newly diagnosed with diabetes mellitus. Which instructions should the nurse include? Select all that apply. A. Wear a medical alert bracelet. B. Check blood glucose as instructed. C. Carry a fast-acting source of glucose. D. Skip meals if blood glucose is normal. E. Inspect your feet daily. Correct answers, A, B, C, E. Rationale. A. A medical alert bracelet helps healthcare providers respond appropriately during emergencies. B. Routine blood glucose monitoring is essential for diabetes management. C. Carrying glucose tablets or juice allows prompt treatment of hypoglycemia. D. Skipping meals can increase the risk of hypoglycemia, especially when taking insulin or certain oral medications. E. Daily foot inspection helps prevent ulcers and infections.
What is your score out of 10? Comment below. Don't forget to like, subscribe, and share this video with a friend who's preparing for the NCLEX. See you in the next practice session.